Childhood Preventative Health Care Services, making life easier for students and families. My name is Mandy LeBlanc. I'm a consultant for the School-Based Health Alliance. Many of you here are familiar with our work, but if not, I want to give you a quick overview of who we are. We are a national organization that works to support and advance school-based healthcare. We do this through policy work, we offer standards to the field, we do data collection, and we provide training, technical assistance, and consultation to support school-based health centers from the planning stage all the way up through expansion and improvement. Before I move on to the learning objectives today, I wanted to review some housekeeping and reminders. You can hear us, but we cannot hear you. You can use the Q&A icon at the bottom of the screen to ask any questions you might have, or you can put them in the chat. We'll save questions for the end of our session today. We will have a portion reserved for that. If you wish to have closed captioning turned on, there should be a button on your screen that either says CC or closed captioning. We also will have a set of evaluation questions at the end of the webinar that we encourage you to complete, as it helps us to provide the best content and tailor it to the voices of those in the field.
And just as a reminder, all recordings, slides, and resources will be shared after the presentation, maybe even later in the week.
Donnie. And here are our learning objectives for today. Participants will be able to remember the importance of preventive health care in supporting and enhancing overall well-being of adolescents, understand key components of adolescent preventive healthcare services, developmental screenings, and health education, create a plan to collaborate with families around why and how school-based health centers can improve children's health. And again, my name is Mandy LeBlanc. I'm a contractor with School-Based Health Alliance. I'll toss it over to Donnie to introduce himself.
Thanks, Mandy. Hi, everyone. My name is Donnie Grieco, and I'm associate here at the School-Based Health Alliance. I'll pass it over to Tammy.
Thanks, Donnie. I'm Tammy Greenwell. I'm a senior vice president here at the School-Based Health Alliance. And I'll pass it to Anna Maria.
Thanks, Tammy. I'm Anna Maria DiNardo. I'm a family nurse practitioner at Blue Ridge Health and also the associate medical director there.
Great. Well, thanks everyone for being here with us today. And we're going to start off by talking a little bit about school-based health centers, but also schools and how schools support student health. As we all know, comprehensive school health and wellness services are really powerful tools for children to receive access to services. And it's really important to create and uphold like intersecting systems of both health, student health, education, and making sure that everyone feels healthy, they feel safe, and they're engaged with the school. So how do schools support student health? Well, certainly providing those comprehensive school health and wellness services, as we just mentioned. And then those upholding intersection systems of care. So again, making sure they feel safe. And then schools can support student health through several models. And those include school health services and then also school-based healthcare. So what are school health services? So when we talk about that umbrella of school health services, I noticed there are lots of school nurses on our call today. Certainly that is an integral part of the school health services model to make sure that, you know, those nurses are available and on campus. School psychologists are also part of those school health services, and school counselors. Some schools have school social workers as well, so that's a part of the system. And the usual governing entity for these kind of school health services is going to be the local education agency. So that's who is providing the oversight for the schools. And then certainly health and privacy information is also covered through FERPA, which is the Family Educational Rights and Privacy Act, which I'm sure I do not have to explain to most of the people on the call. So, what's the difference between school health services and school-based healthcare? So, when we talk about school-based healthcare, we're talking about a different model of care, usually provided through partnerships with different agencies. And those can be like federally qualified health centers, which Anna Maria is from. She's going to speak to that um, in just a little bit. And really, it's a collaboration with the schools, the administration, the school district to provide those services either on the school campus, either in the school, or maybe on the school campus. So they are provided in different ways. But most of those school-based healthcare centers are providing things like primary care, mental health care. Some provide oral health care, and others also provide vision services. So it is a very comprehensive uh, model to provide adolescent pediatric care. So what we generally try to say is that when you think about a school-based healthcare center or school-based, thinking about pediatric healthcare professionals providing services and care on a school campus, with the students being the main focus. So, as we're all aware, students come to school with strengths and with health and social needs. So, imagine being a student coming to school and you feel sick, or you don't know how to deal with your anxiety, or maybe some other things that are coming up in your life as you're coming to school every day. And so, there are school nurses, there are school psychologists, but a lot of those schools across the US, they may not have a full-time nurse. They may not have a full-time school psychologist or counselor. So, how do students access those services when they need them? So, really, what school-based health centers do is they really work to maximize kids' potential by really building on those strengths and then working across systems. So, thinking about building a relationship, it's going to be very local. It's going to be very directed to what students need at that school, in that district, in that community. So that's what school-based health centers really work to do, is to collaborate, bring those healthcare professionals together to support the needs of students. So a lot of times people don't understand the school-based health center model or want to know more about it. So these are a couple of resources for you to look at later on. As Donnie mentioned, you'll get the slides and you can scan these QR codes. But one thing is called the Community Guide. And it really talks about how school-based health centers are able to provide services in low-income communities, how they can help improve educational and health outcomes. And then there's also another article there about cost savings and how school-based health centers really work to maximize cost savings and really provide services that are very cost effective to students and their families. So, what are some of the things that school-based health centers do as far as reducing barriers for students and families? First of all, looking at this as a community, it's community-based. It always is. And looking at the things that may affect the reasons that a student or family may not be able to access care as easily in their community. Certainly, one of those things can be transportation. Not everyone has reliable transportation or public transportation if you're in a rural area or in other areas. So one of the things that school-based health centers do is they eliminate one of those barriers by being located on the school campus or in the school. Certainly time, if you're a working parent, you may not have time to get off work to pick up your student, take them for the care that they need. So that's another barrier that having a school-based health center can also reduce. Along with language, a lot of school-based health centers also make sure that they are providing for any language barriers that may exist for students or their families. And then financial barriers. So making sure that students have access, that families have access, regardless of their ability to pay or what their income levels might be. So they're really planned in partnership, and making sure that in that community, they're serving the maximum level of service for students and families and reducing those barriers at the same time. I'll tell a quick story before we go to the next slide. I worked with Anna Maria for a long time, and one of the things that I always found fascinating about school-based health centers is that once families knew that we were at their school, a lot of times they would send students to school on the bus sick because they knew that at least when they got there, they would be able to be seen by a medical provider, and then they could find out what was happening with their student as well. So I think that's a good way to kind of give you an example of how that transportation barrier can be also eliminated. So how do school-based health centers support students? We've already talked about that quite a bit, but they're providing care that is youth-centered. It's coordinated with families. It's also coordinated with community providers, supported by, coordinated with educational and community-based partners. School-based health centers don't work in a vacuum. They are there at the invitation and acceptance of the school district or the school that they're in. Usually there is I would say 100% of the time, a memorandum of understanding or agreement that outlines how the school-based health center is going to support the school, support faculty, support families, support students. And it certainly doesn't take the place of other community-based providers or even take the place of the school nurse. Work very much in conjunction with each other and support each other. And Anna Maria is going to give us some examples of that. Also, age appropriate. And it's also provided within applicable laws and provisions of that state, that local, if there are any local laws or provisions. Convenient and timely, and again, available to all students regardless of their ability to pay. And I think I've mentioned this, but I'll just reinforce it. School-based health centers are a collaboration. They're definitely something, like I said, it's not working in a vacuum. We always say if you've seen one school-based health center, you've seen one, because they all operate differently, usually all providing primary care services and behavioral health services, but it really is very community-centered, community-based, and dependent on what the needs of that particular school, those students, and that community are. So what is a school-based health center? Like we mentioned, I always try to tell people to imagine it as a clinic, as a primary care clinic or a clinic that is sitting in a school or located near a school. And really it's looking to, increase student health, well-being, and academic success. I can tell you a lot of times school-based health centers are going to be located in areas where there's a lot of high need. There could be, multiple reasons for that need, but making sure that students have that access is really one of the core tenets for the school-based health center. And so providing that comprehensive primary care, which is something that, is just like any other primary care office. So making sure students have access to those services, and you have medical providers. It could be physicians, it could be PAs, it could be nurse practitioners who are able to provide that care as well. And then, as we mentioned, they could be providing mental health. They could also provide oral health, vision care, other services. We know lots of models where there is a physical school-based health center location in a school, and they're providing primary care and mental health care. And maybe they provide vision services or even oral health services through a mobile unit that comes to that school. So there's lots of different models, lots of different ways to approach providing those services. And as I mentioned, working with existing school services and community providers, not trying to replace them. So some questions we get asked a lot, or people who are providing school-based health services get asked a lot, is around consent. So how do you make sure that you have consent to see those students or provide those services? Parent and guardian involvement is very important and always encouraged. Consent for services is required. So it is not something that is being provided without consent, except in those states that may have a minor consent law. So that is very state specific. It is also very state specific as far as what is covered under those minor consent laws. So all school-based health centers, don't necessarily provide services to minors who have consent under state laws. It's really very specific. But if you are in a specific state and want to know more about the minor consent law in your state, we certainly encourage you to look that up as well. As I mentioned, services are determined at the local level in accordance with state and local laws. And really, when I've been involved with school-based health centers, um, generally speaking, I haven't met a school or school district yet who didn't want mental health services. So a lot of times you'll see a school-based health center who will start with mental health services and then they'll add primary care services. So again, dependent on that school, that community, what is the highest need for families and students in that area? And then, of course, confidentiality laws and requirements. We have HIPAA, we have FERPA, we have some of those federal laws, but those laws can also differ between states. So making sure that you know your state consent laws as well and confidentiality laws is really important as well. And then as I mentioned, not trying to replace any of the required school services for the free, appropriate public education, but definitely trying to support and enhance. So thinking about, the school nurse and how do you support that role as far as they may be seeing a student. That student needs to actually, access a treatment or have services. And so working in conjunction with the school nurse is a big part of the school-based health center model. And then not trying to replace parents or guardians, school counselors, pediatricians, or other existing services. Certainly work in conjunction with all of those stakeholders as well. Just some characteristics of successful school-based health centers and programs. They have an advisory committee, so that generally is people from the school district, maybe, other providers in the community. That's usually how things get started, is when a group of those people come together and they're like, we really need to address this specific issue. And so looking at how school-based health centers can address that issue. Student and family engagement, definitely the school-based health center needs to be seen as something that is very important to the students at the school and the family. A strong memorandum of understanding, as I mentioned before, that is a document that's created between the healthcare provider and the school district. There may be other agencies, other people involved in that understanding as well. Providing that comprehensive range of services just to make sure you're providing that access across the continuum. Having adequate space in the school or on the school grounds is also important. And then having appropriate staffing, making sure that when you say you're going to be there and you have a medical provider, that you're there because people depend on that access as well. This is just an example of some information from the 2022 National Census of School-Based Health Centers that the School-Based Health Alliance puts out. And this is just talking about the different school-based health centers and which ones provide primary care, behavioral health, health education, oral health, vision, or youth development. The majority, 73%, are providing primary care and or behavioral health. Then you have about 40% that really focus on a health education piece, 7% providing oral health, 7% providing vision, 23% who really work through the youth development piece as well. And that was from about 1,500 school-based health centers that were surveyed during the census. So what are the key childhood preventive health care components? So when we talk about preventative health care, what are we actually talking about? So certainly part of that aspect is going to be regular well child checkups. So making sure that, kids get access to overall health screenings, height, weight, blood pressure, those sorts of things, anything that you would consider part of a well child visit. Then we have developmental screenings that could be evaluating cognitive, motor, language, social development, those sorts of things. Vision and hearing screenings, I think those are pretty self-explanatory, but growth monitoring as well, if that is an issue, just making sure that a child's growth is tracking to ensure proper development. Nutrition counseling, so educating, kids is one thing, but depending on the age, also educating the parents to help them understand what are good, healthy eating habits to make sure, what is being encouraged or what the kids are eating is also part of a very key piece to that. And then also encouraging regular exercise, active play, mental health assessments, so screening for any particular issues that might be coming up. Talking about education on safety and injury prevention. Certainly, we see a lot of that in childhood, so making sure, you're addressing that as well. And thank you, Andrea. Oral health is also part of that preventive health component. So definitely want to make sure that kids are getting access to oral health services as well. So anytime you're, identifying those potential health issues, early prevention is key because you want to go ahead and address that now so it doesn't become a chronic health issue later or doesn't become a bigger issue later for that student and or that family. So a crucial aspect of that is educating parents about healthy lifestyle choices, how to promote their child's well-being, how to make sure they're, making sure that they're coming to those well child visits and getting that done on a routine basis. Follow-up care, consistent follow-up care with the healthcare provider is definitely essential as they're going through these stages of growth and development to make sure that things are being addressed at the right stage of development and that they have the access to what they need as far as healthcare to address those things like oral health or any of those other pieces. And then preventive care is individualized. It has to be individualized based on the child and their unique needs and their development needs. So those are definitely pieces that you have to look at when you're looking at that early intervention for these preventive health services. And I'm going to turn it over to Anna Maria, who's going to talk more specifically about her experiences.
Thank you, Tammy. So hi, everybody. My name is Anna Maria DiNardo. I'm a nurse practitioner and the Associate Medical Director of School-Based Health at Blue Ridge Health. And Blue Ridge Health is a federally qualified health center, which means we see all patients regardless of their insurance status or ability to pay. We have a large school-based health program with over 30 sites across 7 counties in Western North Carolina. School-based health services can be provided several different ways. We have physical locations where we have medical and behavioral health services. We have school linked, so other students from other schools can access and use our school-based health. We have telehealth medical services, telemental health services, and behavioral health sites only. Currently, we have 16 brick and mortar full functioning school-based health centers that are located at the school. The team who works at these centers is typically a nurse practitioner or physician assistant, a nurse and or a medical assistant, and a licensed mental health provider. At these sites, we provide in-person and telehealth visits. We have telehealth only medical sites, and these are located at our more rural locations and can provide visits with a provider via TytoCare. And so I don't know if you guys are familiar with TytoCare, but it's an amazing piece of technology. It's basically an elevated telehealth experience. So the nurse is at one of the health centers with the patient, and the provider is at another location. But with this technology, we are able to look at their ears, their throat, listen to their lungs, their heart. The nurse is able to do point of care testing like strep or flu. And so being able to do these visits at the school via TytoCare has been super helpful to parents. So instead of picking them up when they're feeling really bad and trying to get an appointment at urgent care or with their PCP, we're able to diagnose them, assess them, and treat them right there, then and there. So yes, these visits are typically acute visits, but we have many of our students end up using us for preventative and primary care when they start using us for TytoCare. We provided over 13,000 school-based health visits last year. This year, we're on target to providing close to 16,000 visits, which is amazing because most of our schools were closed almost a month for Hurricane Helene. But it just shows how our program continues to grow and we continue to give access to care to these students. So preventative healthcare in the school-based health center. So we do thorough well child checks, and there's parents, school nurses, providers on this call. So you know that students need their yearly sports physicals. And so a sports physical form can be completed during the well child check, which is really helpful for students and families. We do vision and hearing screening, BMI screening, hyperlipidemia screening. So that is screening for high cholesterol. The American Association of Pediatrics recommends lipid screening between ages 9 and 11 once, and then also at 17. And all of our health centers have point of care testing. So that means it's just a little finger stick, and then we could get those results immediately. We do risk assessment screening via the RAPS, depression screening, the PHQ-2 and 9, which we'll talk a little bit more about, and then hypertension screening. So every person that comes to our health center that is seen for a provider visit, and mostly most nurse visits, will have their blood pressure. Child checks. So these are done once a year, and insurance covers them if they're completed every 365 days. And we really try to increase the amount of well child checks that we've been doing at all of our health centers. So our registration form has a section that asks parents if they would like a complete physical done at the school-based health center. So our support staff creates a list of these students, and throughout the year, we get them scheduled on the provider's schedule. So people are doing their well child checks at our health center. So again, another way to be super helpful for parents and students, instead of them missing school and going to their appointment for their preventative visit, they can get it done at school. And during these visits, we do a lot of preventative screening. So BMI screening, high blood pressure, depression, vision, hearing, risk assessment, lipid screening if indicated, and vaccines, which we'll talk a little bit more about vaccines. And then this is really when early detection of acute and chronic health conditions are happening. So if a student fails their vision screen, we can refer them to optometry. If they fail their hearing screen, we could get them in a referral to audiology. We are doing a full exam. So a lot of times we do detect heart murmurs, and then we're able to refer to cardiology. Blood pressure, since we are checking blood pressure with nursing visits and provider visits, we have a good log of what blood pressure has been. So if blood pressure is starting to get elevated, we can do early intervention for those type of things too. And if needed, refer them to cardiology as well. And diabetes, we have diagnosed diabetes in the health center. We don't see it often, thank God. But say a student comes in and they're complaining of weight loss and urinating a lot at night and they're very thirsty, this will prompt a workup for diabetes. And vaccines. Okay, so we use the North Carolina Immunization Registry. So this is a state database of vaccines that are administered to the patient. And the vaccine schedule is based on CDC guidance. And at every well child check, we print out the patient's NCIR to see if they're due for vaccines or if they are up to date. And if they are due for vaccines, we are able to administer vaccines in our health centers with parental consent. So we have a very thorough consent form for vaccines. And we can get vaccines from private insurers or state insurers. So it doesn't matter if you have Medicaid or commercial, we can get the vaccines at our health center. And we work very closely with the school nurses to make sure that kids are getting the mandatory and appropriate vaccines for school. So, for example, I work at a middle school, and there was over 70 kids that needed their mandatory 7th grade vaccines. And so the school nurse and she sent me that list. We worked on calling these kiddos, and basically we were able to get 30 of them vaccinated within a week, so they didn't miss school. So that's the most important. We don't want kids missing school, and we were able to prevent that with this partnership with the school nurse. Health education. So at every well child check, we are getting a height and a weight, and mostly at most visits, but this is when we really do address the BMI percentages. So you'll see there's 5 to 85% is normal, 85 to 94% is overweight, and greater than 95% is obesity. So, we definitely don't talk about these percentages with the students. It's just a time that we're able to talk about overall healthy habits. So I love the mnemonic 5210 because it's really easy. So we talk about 5 servings of fruits and vegetables a day, less than 2 hours of screen time, 1 hour of moving your body or some sort of physical play, and 0 meaning trying to avoid juices, sodas, concentrated sweets like cakes and candy. It's really easy for the students to remember, and it really helps open up that conversation about overall habits. And we want to just encourage healthy long-term habits to our students. And one of the screening tools that we use is the PHQ-2. So this is the Patient Health Questionnaire 2. It's a depression screen, and it's typically administered at all of our well child checks at least once a year for our patients. And I also use this during like ADHD follow-ups as well. And basically, it's just 2 easy questions over the last 2 weeks. How often have you been bothered by any of the following problems? Little interest or pleasure in doing things, or feeling down, depressed, or hopeless. And it's on the scale of 0 to 3. So if the student scores 3 or greater, that means it's a positive PHQ-2. And then we actually do something called the PHQ-9, which is on the next slide. And this is the full PHQ-9, and this assesses depression severity. So the severity is based on a scale mild, moderate, or severe. And this aligns with the DSM-5 criteria for diagnosing major depressive. The screener, along with clinical findings, helps us make that diagnosis. So, for example, if I have a student that scores a 21, that indicates severe depression. I discuss these findings with the student during the visit. I would call the parent and let them know what's going on, and we offer a referral to our licensed mental health providers, which most of our school-based health centers have. And so currently that process is taking about 2 weeks to get into therapy services after the referral is placed, which is amazing because in our community right now, it can take 2 to 3 months to access those services. So, and then this form also addresses suicidal thoughts or plan. So if the child does indicate that they are having suicidal thoughts or a plan, we do have protocols in place for that. We immediately let parent or guardian know. We have a crisis center that we use. We work with a guidance counselor. And we try to get we get that kid's needs met immediately. And so there is a mental health crisis among our adolescents. So being able to get these students into therapy services this quickly has been really great for their overall mental health. And this is the RAPS form. This is the Rapid Adolescent Prevention and Screening Tool. This is actually one of my favorite forms that we do during our Well Child Check. I do mostly middle school and high school. So, and this screener is used for students ages 12 to 18. And it really talks about all different things. So it talks about safety and smoking and drinking and drugs. So it really hones in on those things. And in my experience, I find that in the school-based health centers, especially because a lot of times parents aren't at that visit, that the students are really forthcoming and honest about their answers. And it really helps detect high-risk behaviors and steers the conversation in what we should be really focusing on. So, for example, if a student identifies that they're not wearing a helmet or a seatbelt, we can discuss this and discuss the importance of doing that and safety. So if a student identifies that they're worried about their weight and they're starving themselves, that's question number one. At that point, we can discuss eating habits. We do have a nutritionist that comes to our school-based health centers. And so we can put a referral in if parent is agreeable. There's a lot of support groups too for eating, disordered eating as well. And since 2023 in the Parent Bill of Rights, we actually have added overall school-based health consent to that includes consent to these screening tools. So parents are signing and allowing us to do this in the school-based health center. Okay, so you heard a little bit about the things that we do in school-based health centers, well child checks, vaccines, some preventative care, but we also tackle some really complex cases like the two cases I'm about to talk to you about. So case number one, we have a 13-year-old presents to the school-based health center for a well child check. Per the teacher, the student has been having a lot of trouble seeing far away and close up. The student had 2200 vision in their left eye and shared that 1 year ago, they had an accident where a piece of glass got into their eye requiring surgery. They have not followed up with an eye doctor since their surgery 1 year ago. How did the staff at the school-based health support this student? So I saw the student for a well child check. And during that visit, it was obvious that he was in pain and he had a lot of tearing of that eye. So first thing I did was put in a stat referral to ophthalmology. I called Guardian, but that this guardian actually, or this parent did not speak English. They were from a small island called Micronesia. And so we found an interpreter that spoke this specific dialect of Micronesia. And, you know, I explained that I put in that stat referral. Of course, parent was very happy about that. Found out the next day that the appointment was not for 6 more weeks. So I called ophthalmology. I explained the situation. You know, this kid's in pain. He's tearing. He's having a lot of trouble in school. He's also having headaches. Can we get him in a little bit sooner? And they were able to get him in 2 days later. And so then called back Guardian, let her know the great news. She let me know that they don't have any access to transportation. So we worked very closely with the school social worker, and the school-based health RN that I worked with was crucial in this. And we were able to arrange for transportation for the family and the student. So they get to the appointment. The ophthalmologist discovered that a suture was still in his eye from surgery 1 year ago, and that he needed stat surgery to remove it. So they scheduled the surgery for the next day. So we got to get in all of the social work and the school based RN. They got him in to the appointment the following day. He had that suture removed. We followed up with him. So he needed uh, eye drops for 2 weeks after that. So between the school-based health center and the school nurse, we were able to support that. He no longer had pain and tearing in that eye. He did have some decreased vision, but we were able to get him glasses to help with that. So this was just a really great story of using the interdisciplinary team of the school-based health center, along with working very closely with all the supports that the school had to get the needs of this child met. And case number 2. So a 14-year-old female presented to the school-based health center for 2 days of feeling off. She had nausea and vomited a few times, but her vital signs were stable. She was alert and oriented. The nurse practitioner noticed that her skin was jaundiced. How did the staff at the school-based health center support this student? So this student I had seen a couple weeks back for a well child check, didn't have any chronic health conditions. So this was definitely a little bit different, but she felt okay. She just was definitely a little bit yellow. So I ordered some stat labs, and I will say too, we have a nurse that works in our school-based health center. So they're the ones that are drawing the labs. So sent the labs out, got the labs back early the next morning because she had some critical labs. Her liver function, her liver enzymes were extremely elevated. So called parent, let her know that she needed to go to the hospital right away. I called in report to our local hospital. She went in. They started doing a workup and she started to decompensate. So she was actually sent to a hospital in Charlotte, and she had a full workup there, and she was diagnosed with autoimmune hepatitis, which is very rare in adolescents. And so she was there for about a week and a half and stabilized. But during that time, we were in contact with the hepatologist because she would be following up with the hepatologist in Charlotte. And so the hepatologist advised that she would need labs once a week for the next 6 weeks to monitor these liver enzymes. So we were able to do that at the school-based health center, which was great. So mom didn't have to go take her to the doctor's office. She could just get it done at the school-based health center, and we just faxed over those results. And eventually she became stable. She was on medication, and we continue to follow up with her for her other needs as well. So another really, really good example of early detection, working with the specialists in the school-based health center, and just an overall team approach. And so these are 2 cases that illustrate some of the complexity of cases that we have in the school-based health centers, and the importance it is to have access to the place where kids spend most of their time, in school. So thank you guys so much for your time. Mandy has a few closing slides.
Thank you, Anna Maria and Tammy. Great job. I could have listened to those success case studies all day long. I could really feel my heart warming as you were saying some of the things you prevented and caught. Up next, we have a quick Zoom poll just to see how we did today, see how we could do better on future webinars. So Donnie, if you wouldn't mind bringing that up. And at the same time, Anna Maria, we've got some questions in the chat that you can start to look at so you're prepared to answer those. And this is also a good time once you complete the poll. If you have other questions, I can moderate them for our speakers today. So please answer the poll so we know how we're doing.
And just a quick terminology update. It might say Learning Collaborative in the poll. It's for the webinar today.
Thank you, Donnie.
Mm-hmm.
I'll give you a few moments to answer this. We get to see the percentage of people that have completed, so we're rooting for you. Give one more minute for you to answer these 5 quick questions. Great. All right, thank you. Up next, I had mentioned in the chat for some people, we just recently had a Social Influences of Health webinar, and we're about to have a Social Influences of Health Learning Collaborative that starts up next week. The applications are open and close relatively soon. So the way to find more information about previous webinars and upcoming webinars is to go to the School-Based Health Alliance website. That's sbhforall.org. And then if you're looking for the recording for the social influences of health that we recently did, this is the pathway to get there. You can also go in the search bar for social influences of health. And also that would show with the learning collaborative that's coming up. And here are some other resources we have. Coming up, we have the National School-Based Healthcare Conference to keep an eye out for. And finally, to stay connected, these are some ways you can follow us with social media to learn about more webinars like this and the Learning Collaborative and other such things and the work that we're up to. I have to say, I really enjoy collaborating with this team and learning from them. So these are free resources for you to review. And now we can open it up to questions and answers. Thank you for joining us. We're going to jump back up to some questions that we had. So I just want to make sure that we got good answers for you. The first question that I saw was, Anna Maria, do you all administer RAPs through the Possibilities for Change/Atom platform or via paper? And I'll get some other questions while you answer that.
So we administer it through paper and then upload it to the electronic medical record. We do have them laminated just to avoid paper waste, but yeah, they just get uploaded. But I am not familiar with this change and admin platform. So if Heather, you feel brave and you want to explain what that is, please do.
And you can put your other questions in the chat while I scroll back up and go to Alexis's message, which is, would it be possible to share a copy of the registration packet that is used to register the child to the school-based health center, like consents, confidentiality clauses? And anybody else that feels up for sharing that in the chat, they can share their registration packets.
I would have to run that by our people, but if I can, then I will send that to Mandy and then she could send it. But I have to double check. I'm not sure if I'm allowed to do that.
Sure. The next question is, what is your method to obtain consent forms?
So we have a lot of, we have quite a few actually. So we have the paper forms, and in the beginning of the year when there's like the back to school nights, or I forget what it's called, but it's the beginning of the year and they get folders. And we put our registration forms in the folders that all the students get. So a lot of times that's a really good way because parents are just signing every single thing in the folder and it's almost like an opt out. We do also send a link via text message. So I just had this today. I had a student that had a expired registration form but needed to be seen. So I was able to call mom, tell her be on the lookout for our registration form and patient agreement, send it right there. It was done within 6 minutes.
Great. I see that you already answered, but I'll read it out loud, which is, Anna Maria, do all the patients you see at the school-based health center, are they a patient at your community health center? Is that
So
question?
Tammy, you can answer that one too. So not everybody is, and there's so many different ways, but I can have Tammy answer that.
Anna Maria and I used to work together, just so everyone knows that. Yeah, so it really depends. Like Anna Maria said, students can utilize the school-based health center for an acute issue. They may already have a PCP, they may already have a pediatrician. They do not have to then become a patient of the health center, but because the health center is also a patient-centered medical home and provides a plethora of services, including specialty pediatric services like pediatric endocrinology, pediatric neurology, in pediatric psychiatry. There's actually a pediatric psychiatrist who comes to the school-based health centers as well. So there's a lot of benefit to becoming a patient of the community health center. And so I think it really, again, as we've mentioned throughout the webinar, depends on the specific needs of that child and the family. And certainly we want to make sure not only the students getting services, but when's the last time the parents had a health check-in or had those pieces as well. So it really becomes like a bigger discussion about what the needs of that family are, but they can become a patient of the health center, but they're not required to.
And I will say, I actually see a decent amount of family units. And I think it's really helpful too, if one student goes to a school that has a school-based health center, a lot of times, like the entire family, when they're sick, they will come to our school-based health center because of the convenience of it. So that's been really good for families.
Great. Any other questions before I go to some questions that I have? Feel free to put those in the chat while I ask a question. Uh, I will pick a question, which is, can you clarify how these preventative health services are funded and sustained long-term?
Okay. So we're a federally qualified health center, and so we bill insurance for the visit. So if you are having a provider visit, it's like going to a doctor's office. And so we bill just, either sick visit or preventative visit. We have private grants. We just got another grant to continuing to opening up new health centers. So I wouldn't say all of our health centers are sustainable, but that is always the goal.
Great answer. What role can teachers, school nurses, and counselors play in promoting and connecting students to these services?
Just telling the students that we're there. I think sometimes, even though we've been in the community a long time in Western North Carolina, a lot of times people are like, I didn't even know that there was a school-based health center. And I literally have this every day. I didn't know you were here, right? So word of mouth. And we are continuing to think of how to grow our program. So one of the ideas that we have for the next school year is to put something on the Facebook pages, because that's how information is disseminated to a lot of the schools. So just putting our registration on the Facebook page. We have signage out on like half of our schools right now. Like, this is your school-based health center, and it has a QR code that links up to our registration form as well. So just continuing to get the word out, and then working closely with the school nurse. Like, we have no interest in replacing the school nurse. We work so closely with them. They do a totally different role than we do, but school nurses love to have us, because it's like they have a sick kid, they have 101 fever, and they have ear pain. Let me send them over to the school-based health center and get that treated right away.
Wonderful. And thank you, Gone, for putting in some sample consents so that it makes Anna Maria's life easier. And I just want to chime in before I ask a couple more questions, which is, I was a teacher and I worked at a school-based health center. And when I was a teacher, I would notice some kids were maybe disassociating a little bit, not as engaged. And sometimes you can have, when you feel the timing is right, making that referral to have somebody from the school-based health center talk to their kids, and vice versa. When I worked at the school-based health center, sometimes I would just join, awkwardly walk into the staff break room, which I wasn't always feeling like was my space. And I would just join and just see how people were doing and let them know that we were friendly, we're here to help them and build those bridges. So up next is the question is, how do you communicate with parents and guardians after the visit?
We call them.
Okay.
We also have, we have a problem with getting in touch with parents. So we just rolled out OMD. I think that's what it's called, because I don't use it personally, but it's a way to text. And so that has been helpful. Like, if the parent is not picking up, you could be like, hey, trying to call you after the visit. And the nurses help me with that. And then that way we were able to get a hold of them.
Great. This is a private question that was asked about the Social Influences of Health Collaborative. We had a similar learning collaborative last year, and this is the excitedly evolved approach to it. Any other questions before we wrap up? We can stay on for a few more minutes for those of you that may be more introverted and want to ask a more private question. Thank you for joining us. We can give you a few minutes back so that you can go on with your day. And we appreciate the recordings will come out in about a week on our website. And we appreciate all of you for joining us today. Thank you.